It comes a little bit down to pharmacy, like saying pharmacy as in pharmacy instead of pharmacy like a drugstore. And it's about eating healthy. Eating healthy, looking after your body is holistic. It's a pillar of wellness to think about, and it does have an impact in terms of dry eye. So if we look after ourselves, we'll do well. What we look at doing for people, but is they might come into me saying, "I'm already doing all these things. I'm a good boy. I'm a good patient. I'm doing all these things. I have a really good diet. I do all this stuff. And is there anything extra we can do?" And that's where the supplements can come in. And if we talk about fish oil or krill oil or omega-3 oils from plant-based things, because not everyone is willing to ingest fish or krill, you can get good high-rich omega-3 oils from flaxseed oil and chia seed oil and things like that. So there is always alternatives for people that are following a vegetarian or a vegan pathway. And with the fish oil ones, you can go along to any chemist, and there are multitudes of fish oils. And again, that's a bit like eye drops. It's a bit daunting. There's too many things to choose from. So what I like is I've got a couple of products that we use regularly, and one is called Lacratech and one's called Dry Eye Forte, and they're both similar products to each other, and they're a mixture. So they've got a mixture of very high effectiveness omegas, and they've got some flaxseed oil, and they've got some other vitamin oils in there as well. And one of the things that they've got in them is borage seed oil, and borage seed oil is what they call a switching oil. And the wackiness about borage seed oil is if you ingest omega-6s, and omega-6 oils are really common in the Western diet, so most of us have more than we need of omega-6s. When the body eats them and metabolizes them, they get processed down an inflammatory or pro-inflammatory pathway. So borage seed oil comes along in that metabolism pathway and switches a junction and has the metabolism of omega-6s into an anti-inflammatory pathway, which is the cool thing about it. So by having something like Lacratech and Dry Eye Forte, a patient can take one of those or with a prescribed dose of that, and that there has to be safety protocols with that, but not everyone can take them. You have to check with your doctor and your pharmacist. But you can take those a day, and you're getting high level omega-3s. You're getting a special oil in them that actually helps your body process things in a nicer way to make your body less inflamed in general. And they can be really effective. The other things we can look at are some studies are coming out, and I say studies, so it's not guaranteed, but they're showing really good effect from certain supplements. And one of the things that we talk about is vitamin D has been shown in virtually all patient groups to be effective. If you can take a vitamin D supplement, it's going to help reduce some of your dry eye symptoms. And in Tassie, we're fairly lucky because most of our patients are taking a vitamin D supplement because we don't always get a lot of sun, especially going through winter. So, but certainly it's an easy thing to do, and vitamin D supplements are cheap and they're really available. Some of the other things that are coming up is certainly vitamin B. So I just recommend sometimes a good broad spectrum vitamin B complex, but vitamin B12 in particular has been shown to be helpful for Sjogren's syndrome, which is a condition where people don't have enough tears and have some issues with their mucus productions as well. And the other things that are coming up in terms of studies are talking about gut microbiota as well, and that's an emerging area of study. So there's some good evidence behind it, but there's no amazing products that I can talk about so far, apart from talking about saying that having oral probiotics and oral prebiotics, it can be really helpful. But I've got no massive evidence I can say buy this brand or that brand or things of that. And again, there's lots of those out there as well. So it's a busy space. The other thing, which is I guess something that we figured a little bit about, is hydration. Just something simple like hydration. Recommended daily intake of clear fluids for a man is about 3 litres a day. And for women, it's about 2.5 litres a day, or 2 to 2.5 litres. And I know I would struggle to do 3 litres a day most days. I don't think I drink that much in
Yeah,
clear
me too.
fluids. So, and if we know when we look at the serum levels and we take blood from dry eye patients, that they've got high salt levels, which indicates they're dehydrated. So again, hydration is a key thing. It's really simple. It just means take more effort, drink more water, and be more proactive with it. And further with the hydration is just being mindful about alcohol consumption. Alcohol consumption is definitely aligned with dry eye symptoms, but it's unusual with its impact between the sexes. So women that even have one drink a week will have an impact on their dry eye symptoms, whereas men can have a drink or two a day and have minimal impact on their dry eye symptoms. So it seems rather unfair, but while you've
Yeah.
got dry eye symptoms, yeah, the women should probably abstain as much as possible. and guys should be mindful not to overdo it.
Yeah. Well, maybe you can settle an argument for me, and this is to do with fish oils. So I think there are particular fish that are more have more omega oils than others. Like I think it's like mackerels and I don't know if it's sardines, but there are certain fishes anyway that maybe
I
have
think
more.
there are types of omega-3s which are important, and
Yeah.
there's high density and low density ones, and that ratio is there in all fish, but they can
Mm.
extract what they're wanting out of certain fish more efficiently. And
Okay.
I guess that's where the morality of fish oil comes into a bit of a grey area as well, because should we be harvesting a massive amount from the oceans, which are in some level of stress. And I'm also mindful of that with krill, because krill oil is a really good alternative to impacting fish, but only if it's farmed krill. If they're harvesting krill from the oceans, krill is what feed the whales, and that's the bottom of the food chain. Again, I've got some concerns with over harvesting things from the ocean, but again, there are some safe products out there, and most of the ones or the ingredients that are used in the Lacrotec and the Dry Forte are being used from food production, so they're all
Right.
getting oils from stuff that's wasted in the food production areas of farmed salmon and the like.
Right. So the argument was this, that if somebody says, well, I already eat a lot of fish in my diet, I have a lot of salmon and so on. I don't need to take fish oil
Yep.
supplements. Is that true? Do you go along with that? Because I have heard some people say, I've had some people say that you'd need to eat an awful lot of fish in order to get the same level of benefits, and you might actually be like exposing yourself to mercury poisoning along the way. So I don't know if it's true or not.
The therapeutic dose for omega-3 supplementation is about 2,000 milligrams a day, so 2 capsules.
Mm.
So it's a lot. So if we just Google that, 2,000 milligrams of omega-3, you'd have to eat it's from America, so 8 ounces of fatty fish like salmon, and a typical serving size of fish is about 3 ounces. So it's almost 3 servings of
Yeah.
fish per day. So
You'd have to really binge on the
it's a
fish.
fair bit. Yeah, so if you have
Yeah,
fish once a week, you're not cutting it.
yeah,
So you're not
yeah.
getting even close. So
Good.
especially since most fish we would have once a week is probably not high oil fish as well.